discuss about whether therapies are important for children with virtual autism. I hope you all understood by now that virtual autism is not the term coined by a professional bodies, but yes, clinically we are coming across few children whose skills are getting delayed because of high exposure to the screens. So that transient delays in the children might be termed under the category of virtual autism, but definitely you need to have a professional assessment before coming to any conclusion. And as a parents, we cannot come up with a complaint that my child is under virtual autism or they are under classical autism. It's our duty is only to elaboratively explain the signs and symptoms or the development which is undergoing by our own children or what you have observed in our own kids. And it's definitely the professional's duty to identify whether there is a delay in development, and if yes, it's their duty to understand the root cause for it, and finally come to a conclusion on what is the appropriate label that is best suited for the child. We cannot, peripherally, we cannot comment on the terms of virtual autism or the classical autism. So please do remember that in mind. This is Dr. Jyotsna Tanigundala from Daffodils Child Development Center, Hyderabad. And coming on to the answer, yes, it is always important to start early stimulation to children who are having delays. Whatever the label it could be because of virtual autism, or it could be because of autism, or just a hyperactivity or inattention. It's always better to create an appropriate environment for the children so that their language gets facilitated, so that they will start learning a more appropriate manner of communicating with others and reducing their inappropriate behaviors. Whether as parents or as therapists, the only key which we have in our hand is the early identification, utilizing the neuroplastic age to the maximum, and creating a 100% stimulating environment to the child. These are the only three things which are there in our hand. And therapies is one way of enlightening the parental knowledge and the child in order to create this environment in order to facilitate direct improvements in the children. So when you go to the therapies, there will always be two segments. One is the direct dealing of child, that is called the child therapist, and second thing is towards the parental training. So please take your step forward and take an active participation in getting yourself trained by the professionals, so that once the therapy is over, once you and the child goes back to home, it's always our duty as a parents to follow the recommendations and to repeat the goals, try to create appropriate activities and try to create healthy environment so that our child will get facilitated towards a better development. So in short, yes, it is important always to seek a professional advice on how much delays and what to be done in order to reduce the delays irrespective of the diagnosis. Thank you.